A tube entering your arm through a vein goes to your heart. One pull, one mess up, vital damage can be done. Hello, my name is Levi Hill, and today I'm going to talk to you about what a medical PICC line is, its uses, a little bit of some risks, how to properly administer antibiotics through your medical PICC line, and some useful tips to help you when doing this procedure at home. So, what you might ask, what relevancy would this have to me? Well, a lot of this PICC lines are used for people who come out of surgery or elderly folk, and if you need antibiotics administered right away, it's very useful that your doctor may prescribe one. I myself have personally had to use one for my grandfather and have thoroughly researched this topic. Now, stepping into the world of at-home medical care, let's discuss what a PICC line actually is. According to MayoClinic.org, a peripherally inserted central catheter, or PICC line, is quote-unquote a long, thin tube that is inserted through a vein in your arm and passed through larger arteries and veins near your heart. End quote. So, it usually is in the elbow region, right around here in this area. Here's a picture of a PICC line procedure generally and how it's brought about. All of my images are courtesy of Google.com. So, you might ask how you get this inserted. Well, it's an outpatient procedure, and according to infusionsolutions.com, it's inserted by a PICC specialist using X-ray or ultrasound images to ensure that your PICC line is in the right area without touching any vital organs and causing any damage that way. Of course, with this procedure, there are a few risks, such as those listed by cancerresearchuk.org, which may include getting the line dirty, a clot in the line, a blood clot going through the vein, and if you're clutching your clothes on, you might nag it, and if any of these happen, you'll have to go back to your doctor and have them pull out the PICC line and insert a new one. So, what PICC lines are generally used for, according to macmillan.org.uk, is really helpful for those who are going through chemotherapy, blood transfusions, antibiotics, IV fluids, and if you're unable to eat, food as well. So it's used in a variety of number of medical clinics and hospitals, but generally for at-home care for antibiotics administering if you have an infection. So now that we've discussed what a PICC line is, its uses, and some risks while using it, let's have a step-by-step breakdown of how to administer it at home, as they will usually do. So you're going to want to have all your necessary supplies laid out before you begin. But always be first to wash your hands. This is very important to make sure your PICC line does not get clogged or dirty. If you want to reduce risks in any way, be sure your hands are washed and be sure to put on a clean pair of gloves. Now, in my experience, some supplies we needed to use were alcohol wipes, syringes of saline solution, which are provided by your doctor, your antibiotics, caps for your PICC line, which are also provided by your doctor, and in case you need any new gloves or things of that nature. So you're going to want to first, after you wash your hands and put on gloves, is to lay them out on the tables for you. I usually have everything laid out ready and ready to go that way. Next, what you're going to want to do is take the green cap, which looks similar to this. You take the green cap from right here. Be sure to hold the clear part, not the green part, and untwist or unscrew with your fingers. Be sure to get it done. Then take a clean alcohol wipe, and you're going to want to wipe where you took off the cap from. Once that's done, be sure to have your saline solution ready. Take that, screw it onto where the cap once was, and be sure to push it in fast. You want to do this one fast, that way there's no complications. Once you're done there, take that off, have your antibiotics ready, screw that inside, and according to your doctor, he'll let you know how long you're to put the antibiotics in, because you're not supposed to push it in all the way. So depending on what your doctor says and the prescriptions and orders of what you get by nurses, be sure to time out how much you're going to put in and put it in accordingly until it's all inside and in the proper time allotted slot. Once you've done that, be sure to unscrew your antibiotic solution, put that away, and then you're going to get another saline syringe. Add the syringe to the cap end where you had it, push that in fast. You always want to do the saline fast. That way, make sure it flushes through your system and everything's good. Make sure your line's clean. And then from there, you're going to want to, what I did was, just to be sure and take extra precautions, I took another alcohol wipe and I wiped the area after I removed the syringe of where it's going to go. Then what's going to happen is you're going to get another cap from your roll caps, which is usually provided by your doctor or whatever healthcare provider you have, depending on their delivery system. For us, it was calling a pharmacy, and then their deliverer would come to our home and hand us all of our supplies. So it's going to end up looking like this. And from there, you're going to just simply attach the cap. Now you're going to see a little drip, and you always want to make sure your PICC line area is dry, but if the tube right here, you're going to feel a little drip on your glove. If you see that, that means that the cap is unsecure and you've broken the seal, so it's clean and you've done it correctly. Then you're going to want to let it go and then wait till you need to do another re-administration of your antibiotics. And that was a lot to take in, especially on one go. So we're going to talk about some useful tips that help me go through this. According to apic.org, you're going to want to always make sure your dressing is clean, especially when you're showering. Be sure to use the sleeve provided to you by your doctor. And before you start your procedures, always make sure that the area around your PICC line is firmly stuck to your skin. That way nothing can go underneath, there's no dirt, and you'll be safe when using it. Always be sure to never pinch the line, the little line attached to the tube. Make sure never pinch it, clog it, or bend it. Always make sure your line is straight whenever you're administering your antibiotics or whatever medication you need. And some tips that I learned when I was administering the antibiotics as well was I made myself a little cheat sheet and was able to write saline, antibiotic, saline, and keep them all organized. That way I know where all my supplies are, and I don't reach for the wrong one. Also, because they come in a syringe, I usually generally opened the saline, but never took the cap full off. That way, it was a smooth, easy transition. That way, I wouldn't have the line exposed for too long. And with that, I'll leave you with these. Now that we know what a medical PICC line is, step-by-step instruction of how to administer antibiotics, and some useful tips on how to help, I'm going to leave you with these closing thoughts. You're always going to want to know what medicine and how much to give. You're going to want to always follow doctor's orders and prescribe supplies as needed. And in conclusion, PICC lines may seem scary. One wrong pull and you'll have to get a new one. But if you follow my simple steps, always make sure you're clean. Soon you'll pick up the right skills and timing in no time. Thank you.